Hello, everyone, and thanks for joining Spotlight on Data Quality, Maximizing Revenue Potential. My name is Jordan Leibovitz, and I'm part of the marketing team here at IMO. Before we get started, I want to take care of a few items for those attending. First off, this webinar is being recorded and will be available to you for future viewing. Throughout the session, all attendees will be in listen-only mode. So if you have any questions, type them into the GoToWebinar console. We'll have a brief Q&A at the end, and we'll get to as many questions as we can, but if the reason yours is not addressed, we'll follow up with you after the presentation. Today, we have our very own Senior Sales Engineer, Megan Broom, speaking. As mentioned before, if you have any questions or comments while our presenter is speaking, please type them into the question section on your control panel. With all of this being said, I'll pass it over to Megan.
Thank you, Jordan. Good afternoon or good morning, everyone, depending on where you are. I'm excited to talk to you guys today about our next Spotlight on Data Quality, and we are going to be focusing today's conversation on maximizing revenue potential. As Jordan mentioned, my name is Megan Broom, and I am a Senior Sales Engineer here at IMO. I support multiple of the products within our portfolio, lately focusing on our insight solutions, and excited to tell you about the new things that IMO is up to and how that will help increase your bottom line. Aggregated clinical patient data is a powerful resource in healthcare. It drives care delivery, informs analytics, clinical research, it powers precision healthcare, population health initiatives, and it can also help you understand how to recapture revenue most efficiently and power the ability to take on more risk, which can actually lower your overall organizational costs for caring for patients, while also improving the care that you're able to provide. As everyone on this call knows, though, as we gather this data from a variety of sources and we consolidate it, it is often highly variable and full of gaps. And as a result, extra resource time is spent manually filling in those gaps, which adds an unnecessary drain on your resources that you do not have and doesn't allow you to unlock the financial value of patient data. Instead of skipping from aggregating patient data to trying to do self-service analytics, this is where IMO sits in the middle. And it is critical to both normalize and enhance your data set so you can really have accurate, informed decisions on that data. Preserving revenue integrity is challenging due to clinical data quality issues that plague the healthcare system from the point of care all the way down to the downstream data lake. From one aspect, missing codes or lack of specificity leads to revenue loss, and that leads you to wonder how you could have better captured this revenue to begin with. After the claim is rejected, how can you understand where you could have done something better? If you want to keep high-risk patients in your network, are you prepared for that? Do you have the supplies, the providers, the infrastructure to support them? Do you feel that you really understand the patient population in your area so you know which risk-based contracts make the most sense for you, where to target outreach, or even where to build your next brick-and-mortar building for where there is lack of patient access? Revenue is lost when you're not projecting your populations correctly. Do you feel like you understand your costliest populations and can quantify that risk? IMO Precision Normalized unlocks the ability to find these insights by normalizing your patient data for revenue analytics. Almost 60% of hospital leadership says that they have lost potential revenue in the last 12 months due to poor quality data. And this is a problem that IMO can solve for. Let's talk about how Precision Normalized powers revenue recapture. And we'll go ahead and use a specific Medicare population example to make it real. Medicare Advantage has tripled in size over the last decade, and it can be a profitable program, but it relies on capturing accurate and highly specific HCCs. This isn't always easy. Consider a complicated diagnosis with multiple secondary codes like the one I have up. A diabetic patient with end-stage renal disease on chronic dialysis due to type 1 diabetes. There is a whole lot of information contained within that description, as well as multiple codes to represent it. If a secondary code for renal dialysis is not properly captured, it wasn't stored within the system constraints, for whatever reason is missing, reimbursement will be significantly reduced for this patient. While one instance may seem insignificant, when multiplied across a population of patients with varying diagnoses, gaps like these can make a big impact on your bottom line. Where IMO Precision Normalized fits in is it gives you the ability to analyze the success downstream of your code capture related to your Medicare population and to highlight frequently missed HCCs, even down to the service line or the specialty where these codes are being missed. Having these insights allows you to make changes at the point of care through education, alerts, to ensure that these critical HCC codes are not missed the next time. Aside from revenue recapture, another area to realize more revenue is through taking on more risk. Risk-based businesses are producing strong results in healthcare, and these are driven by positive returns on these investments. Public policy is driving risk-based contracts, private payers are getting on board, and public investors are seeing that this is a profitable space and they're getting in on it too. Value-based arrangements allow you to build better care models without having to worry about being reimbursed patient by patient for each individual service. These more robust care models provide more frequent care, which better meets patient needs and better helps providers to manage their patients and their conditions. While value-based contracts are just getting started, the potential is huge given the expansiveness of the healthcare market and early evidence that we are able to improve patient outcomes and lower system costs by taking on risk-based contracts. But when does risk make sense? You can't know if you do not understand your patient populations. The first part of enabling risk-based models is obtaining as much patient data as possible to power the decisions. Data from previous encounters will help inform on what conditions that they may have and what medications that they may be on. But this data can be obtained from health information exchanges, directly from payers, from previous providers. You can have archived patient data as well as real-time patient data that happens after while a patient is being admitted or discharged. And this patient data is also critical in a patient's outcome and overall giving understanding to their cost journey. But what about the quality of this data? Your insights are only as accurate as the coding that comes along for the ride, which leads to the next point. Data must be normalized. Health systems and payers get data from many different EHRs, which leads to gaps and inconsistencies due to system constraints or issues with point of care capture. Once the data is normalized, it becomes accurate and understandable, and now it can feed the self-service analytics platforms, combining that with business logic to determine how you can best take advantage of the risk-based contracts that can improve your bottom line. IMO Precision Normalize is able to both standardize HIE data, for example, in bulk, and real-time patient data via an API stream at over 300,000 terms a minute. And there is no one better than IMO to normalize patient data, as we're the ubiquitous clinical terminology vendor in the United States, used by 90% of providers for diagnosis capture every day. The depth and the breadth of our corpus of clinical terminology allows us to be able to preserve clinical expressivity and preserve clinical intent while powering self-service analytics with accurate data. So let's keep talking about the complexity of understanding patient data and the danger of using crosswalks instead of normalization. To any oncologist, the concept of breast cancer metastasized to pelvis is a good clinical expression, but no one code set used today expresses it. You would need to choose 4 individual SNOMED codes and 2 ICD-10 codes, and only if you get the correct ICD-10 codes. If your starting software program only captured the minimum acceptance criteria for this expression, you only need to capture the primary SNOMED code and primary ICD-10 code. You're technically correct, but it is missing the clinical validity and ICD-10 coding requirements to document the metastasis, effectively leaving money on the table. Compound this to the handful of other software programs run at your practice, home health, hospital, ACO, and if those solutions are only looking for the codes, not your breast cancer metastasized to pelvis expression, and only captures those primary codes, the downstream software solutions will not pick up the other codes and you would need to fill them in with crosswalks. But those will break every time. As you can see from the full list of crosswalks here, which one would you choose? They are all incorrect compared to the coding guidelines that we adhere to. That's why it's so important to make sure that you're capturing all of the codes associated with the description while preserving clinical intent. And that is the true magic where IMO is able to combine both. As stated, when data is extracted from diverse health information systems and aggregated, the resulting data set is highly inconsistent, which you can see here. If we look at the data on the left, we have 4 problems that are expressed in different ways with inconsistent code sets. When we look to the right, we can see that all of these terms match to IMO's uncontrolled type 2 diabetes with renal manifestation. The inconsistent representation of this condition within an IDN or health analytics platform will not only make it difficult to identify patients who may have this condition, but also would make it difficult to analyze metrics such as the cost of treatment and quality of outcomes associated with this problem. As you can see, once you run this clinical data up into the cloud through IMO Precision Normalize, it is able to be returned standardized to a common definition of meaning, represented by an IMO ID, as well as all of the external code systems that align with this diagnosis. We don't just normalize diagnosis, IMO also normalizes procedures, labs, medications, and I wanted to show a specific example here of where we performed a clinical data quality double check, where a site was able to send in this lab test with this LOINC code. In this case, we were able to validate that this LOINC code was correct and then enrich this term with both the SNOMED and the CPT code. Now this term is fully codified and is able to be utilized in any quality metric, analytics platform, any sort of drivers at any BPAs at your site that are looking for codes. Unless you have all the codes associated in the stream, this term cannot be fully functional within your system as you would hope. I also wanted to end with just a few quotes here that we hear from our clients about how IMO Precision Normalize is able to power maximizing revenue at their organizations. In the first quote, this is from a business intelligence team that Precision Normalize is allowing them to take external HIE data and normalize it so they can really understand their patient population. And now they are able to unlock predictive analytics and they can make high confidence business decisions in a very competitive market where they're found. They would not otherwise have these capabilities, and they know that they do not realistically have the internal resources to be able to solve for the clinical data quality problem or create a tool to do so. This tool will be a critical tool for their success. To highlight the second quote here, this talks about how IMO Precision Normalize is able to increase the accuracy of their data so that they're able to benefit from other revenue generating streams such as quality awards or pay for quality programs to help increase their operational efficiency and effectiveness, which is in alignment with their strategic plans. And that's what we want to do here at IMO is we want to power your success. And by powering your clinical data, we're able to do that because through reduced data quality, it results in reduced reimbursement. So with IMO Precision Normalize, we can improve that data quality and you can see maximized reimbursement. With all of that being said, I am prepared to take any questions at this time.
All right, Meg, we have a question that came in, and it's how can your normalized engine increase my RAF scores?
Absolutely. The way that we are able to increase, we do find that through Precision Normalize, that we see a normalized data set increases the per patient RAF score by around 6%. That being said, this is a downstream insights tool that you are able to see where you have missed those HCC codes that have resulted in that lower reimbursement and that lower RAF score. So where we're able to provide an analysis to where you see these are the HCCs that I'm frequently missing. This is the specialty where I'm most frequently missing this HCC. Now I'm able to go back and do targeted education or create alerts within my system so that when those conditions are chosen the next time, it alerts the provider or they have been educated that this is a frequently missed HCC, and so they're able to add it back in, and then they're able to achieve an accurate RAF score for reimbursement the next time.
Awesome. Just a reminder, if you have any questions, put them in the question box. But another, we have on May 20th, the last installment of this series. It's Spotlight on Data Quality, Clinical Research and Trials. We will send a registration link out, but we ask that you sign up. And I think we don't have any other questions, but so we're going to go ahead and close out for today. Thank you so much, Meg. If you have any questions regarding IMO or IMO solutions, please email your client executive at sales@imohealth.com, and we'll get right back to you. Thank you. Bye.